First of all, parturition, that is, of course, childbirth. And what you require for childbirth to occur is contractions of sufficient strength of the uterine myometrium, so that's the smooth muscle, that are sufficiently strong to expel the fetus. Because parturition, therefore, requires dilation of the cervical canal. The cervix needs to be wide enough to allow the baby to come out. And you need contractions of that smooth muscle. And of course, as we've covered in earlier sessions, that is stimulated, or that is achieved through the actions of oxytocin, stimulating smooth muscle contraction. But the uterus is actually very quiet in the first 2 trimesters, and that's because of those elevated progesterone levels, which keep that smooth muscle contraction under control, so keep it quiescent. But in trimester 3, mild contractions start to occur. In other words, the uterus starts to become more excitable. And these mild contractions become more regular and some become regular enough to be mistaken for the onset of labour. It's also known as false labour and Braxton Hicks contractions. And as parturition, as childbirth starts to approach, the cervix ripens. And that's due to the action of a hormone called relaxin. Now, relaxin causes the breakdown of collagen fibres around the tightly sealed cervix, therefore loosening it in preparation for birth. Remember, the cervix is usually very tight during pregnancy to prevent infections, for example. Relaxin also relaxes the birth canal by loosening connective tissue between the pelvic bones, and it's also involved in loosening of joints, so increases injury susceptibility when exercising, for example, especially when ladies who are pregnant start taking up new types of exercise, as it does affect to some degree most body joints. So as parturition approaches, the fetus drops so that the head is in contact with the cervix. And of course, a breech birth is a birth where any part of the body other than the head approaches the cervix first. And then they would try and do manipulations to turn the breech into the correct position so that the fetus has head in contact with the cervix. And if that isn't possible, then the most likely scenario is to have a C-section. So as contraction strengths increase, and we'll talk about the stimuli for contractions in the first place, but as those contraction strengths increase, the fetus is forced against the cervix, and that causes the cervix to dilate. So when we're looking at the stages in parturition, there are 3 phases that we'll talk about, and that first stage is dilation and contractions. And if you remember, estrogen and progesterone levels are gradually increasing during the pregnancy, and they're getting higher and higher. And those high estrogen levels just prior to parturition stimulate oxytocin receptor synthesis within the uterus. So now we've got lots of oxytocin receptors within the uterus, because there aren't that many before estrogen is stimulating them. And the stretch of the growing fetus activates mechanoreceptors, and those mechanoreceptors pass those signals up to the hypothalamus and the posterior pituitary and stimulate the release of oxytocin. And oxytocin can then bind to those oxytocin receptors within the uterus, causing smooth muscle contractions of the myometrium. So in other words, what we get at the beginning of parturition, at the beginning of childbirth, the estrogen levels are getting higher and higher, which in themselves stimulate an increase in oxytocin receptor synthesis, such that the oxytocin receptor density increases. We then get stimulation through mechanoreceptors, so the stretch receptors in the uterus, they are activated, and that causes the release of oxytocin from the posterior pituitary. Oxytocin acts on the smooth muscle within the myometrium to stimulate uterine contractions. That pushes the fetus against the cervix, and then through neuroendocrine reflexes, because we're starting to get pressure against the cervix, for example, we start to get an increase in oxytocin secretion, which leads to more uterine contractions, which pushes the fetus against the cervix, leading to more oxytocin secretion, and you get this positive feedback loop. Now, estrogens in themselves are also known to cause contractility of the uterine smooth muscle. And as well as that, there are other possible triggers of parturition. This includes things like the age of the placenta and those increases in oxytocin that we've already mentioned. And CRH, corticotrophic releasing hormone, the levels of that within the blood are a very good indicator of when parturition is about to occur. It's also known as a clock that can help you predict when childbirth is likely to occur. So, like I've said, parturition is completed by this positive feedback cycle, such that at the beginning of labour, contractions last less than 30 seconds or occur less than once every 30 minutes. Whereas at the end of labour, contractions can last 60 to 90 seconds and occurring every 2 or 3 minutes. They're becoming a lot more regular and they're becoming stronger. And each contraction begins at the top of the uterus and sweeps down, forcing the fetus towards that uterus. And as we've said, the pressure of the fetus against the cervix reflexly increases oxytocin secretion, such that we have this positive feedback cycle, which is progressively increasing until cervical dilation and delivery are complete. Remember, oxytocin also stimulates prostaglandin secretions from the decidua, and that further enhances contraction strengths. So the second stage is delivery or expulsion. So as the baby moves through the cervix, those stretch receptors are activated, but we also start to activate stretch receptors within the vagina, and they activate neural reflexes that trigger abdominal wall contractions. And just so you know, female abdominal muscles are very, very strong for this very reason. And this is termed pushing. So the mother now voluntarily contracts the abdominal muscles at this time. In other words, they're pushing with each labour pain. So the abdominal wall contractions are in synchrony with the uterine contractions, which greatly increases the force pushing the baby through the birth canal. This stage usually lasts around 30 to 90 minutes, but in particular in a first pregnancy, it can last a lot longer. The umbilical cord is tied and severed, because remember, at this point, it's still attached to the placenta, so it has to be cut and tied. And the stump then goes on to form the navel or the umbilicus. Because remember, what happens when you cut it, it shrivels within a few days to go on to form the umbilicus. So the third stage, we've now delivered the baby, but we've also got to get rid of the placenta. And so the third stage is delivery of the placenta. So the next series of uterine contractions separates the placenta from the smooth muscle of the uterus, the myometrium, and expels it through the vagina. This is also termed the afterbirth. Usually occurs somewhere between 15 and 30 minutes after baby delivery. And so the myometrium continues to contract at this point. And this is very important because it constricts the uterine blood vessels supplying the placental attachment site. And of course, constriction of those blood vessels helps to prevent hemorrhage or significant blood loss because you're contracting, squeezing those blood vessels closed. And that diagram that you can see on the left-hand side there, that's just showing the placenta and umbilical cord after birth.